Hello, everybody. Thank you for joining our webinar today. We're going to wait a couple more minutes for a few more people to join. I know a lot of you are at your lunch hour right now, so it's a great time, quick 30 minutes. Feel free while you're joining to go in the chat box and let us know where you're joining in from. It'll be fun to see how far this reaches. We have a big audience today to listen to our awesome panelists. Let's see. Okay. So today we're going to be discussing what happens at the intersection of ADHD and nutrition. October is ADHD Awareness Month, so we wanted to bring on Catherine Callahan, Dr. Liddell, Heather Liddell, to talk about the relationship between ADHD and nutrition. And we'll get more into their qualifications in a second. It is estimated that 1.6 million children have been diagnosed with ADHD in the United States, and across the globe, 2.8% of the world's population has been diagnosed. If you're a family learning more about your child's ADHD diagnosis or a healthcare provider in the line of care for these families, this discussion's for you. We're going to be sending out a recording of it after to all of all the people that are registering, and feel free to ask questions in the chat box. We can get to them after the webinar. We can email you back about them. But this really is meant to be a discussion for learning and just an open conversation. Some housekeeping before we dive into it. So like I said, just submit all of your questions in the chat box. We'll take time to answer them. And if we don't get to all of them, we can answer them offline. And at the end of the webinar, you'll be directed to a survey. So if you guys could fill out that survey, it'll really help us out for our future webinars. We're going to be doing these once a quarter. And then that'll trigger the webinar getting sent. So we're going to start with our presenters. First, we have Catherine Callahan. She is a speech language pathologist, pediatric feeding specialist, and a certified lactation counselor with over 15 years of experience working with infants and children in a medical setting. She resides in Chicago, where she works at the Ann and Robert H. Lurie Children's Hospital of Chicago and owns her own business, which is awesome, which is ChiKids Feeding, LLC. At Lurie's Children, Catherine evaluates and treats infants and children with feeding and swallowing difficulties, performs video fluoroscopic swallow studies, and works alongside a GI physician, registered dietitian, and occupational therapist in the gastrointestinal feeding clinic. In her private practice, Catherine offers in-home and virtual feeding evaluations, treatment for local infants and children, and through her social media and blog, she shares everyday feeding strategies and supports families and professionals across the globe. Catherine, what's the name of your blog?
It's just ChiKids Feeding.
Okay, great. So you guys feel free to go check that out too. And then we also have Dr. Brian Liddell. He's a board-certified pediatrician, and Heather Liddell, who's a registered dietitian nutritionist. They're a power team over there. Through their blog, podcast, social media accounts, and feeding coach services, Brian and Heather help families keep their kids healthy and learn to feed them with freedom and grace. There's so much noise around the best way to parent, but Brian and Heather work to provide evidence-based medical and nutrition information in simple and clear ways to empower parents to make the most educated choices for their family. So we're going to start this discussion talking about the implications of appetite when utilizing ADHD medication, which is usually stimulant medication. So we know that many people, or many children and people, but children specifically, are being treated with this medication that impacts their appetite. So let's start with what are the nutritional concerns with children that are taking these medications?
Yeah, I think from my standpoint as a pediatrician, like the biggest concern with the stimulant medicines is just appetite suppression. And I think a lot of medical providers who prescribe these medicines are using long-acting stimulants that last all day long. And so the biggest hurdle is usually kind of middle of the day when the medicine's at its peak in their system. So from my standpoint, that appetite suppression around lunchtime and during school can be a huge problem. And so oftentimes we have to kind of push calories to either the beginning of the day or the end of the day in order to keep the kids' nutrition's good. I think there's some evidence too, Heather, maybe you could speak into this. There is some association with some nutritional deficiencies, and those are things like low iron, low vitamin D, low zinc. Those are not true for every patient with ADHD, and they're not necessarily related to a side effect from the medicine, but probably more related to just their lack of appetite and poor nutritional status.
Okay, great. So you said zinc's the big one, iron for these. So those are some nutrient deficiencies to look for with children being treated.
Yeah, and I think medically there's other symptoms that might come along with those deficiencies. So if you're a parent of a kid who's on a stimulant and you're worried about their appetite, it's definitely worth asking their medical provider about any concerns you have, and those things can be tested for and supplemented if necessary.
Okay, great, thank you. So Catherine, what are some of the strategies you use for children getting enough calories and nutrients with the appetite suppressing medication?
Yeah, I think like the biggest thing I would say is keeping a consistent mealtime schedule and routine and making sure the child is aware of that. So using something like a visual schedule for a younger child, that could be pictures, older child could be written, but so that they're eating at the same times each day and in the same locations as best that you can make it. And you know, that they know what to expect, and that they keep coming to the table, maybe even if they're not feeling as hungry, but they're there and that the food is ready for them. For an older child who maybe, you know, if they're coming home from school and parents aren't home, having food that's already prepared and in the refrigerator, so it's easy, they can pull that balanced meal out and they don't need to think through, you know, planning what they're going to eat or putting it together, can be really helpful.
Okay, great. So aside from like scheduling and just the repetition of that, is there any tips or techniques that you give to parents or professionals to make eating time like a less stressful experience for when kids really just don't want to eat?
Yeah, I mean, I would say definitely planning each meal with at least one or two things that you know that they like to eat or that feel safe. So they're coming to the table, even if they're not feeling hungry, or if they are feeling hungry, they know they have something that they feel like comfortable coming to. And then I think even, removing distractions from the environment, with all kids, but not having the TV on or not having phones at the table or toys at the table, can help them to really focus more on the food. I think kids who tend to want to have difficulty sitting at the table and wanting to get up and move around a lot, using something like a visual timer. So not that they're going to have to sit and eat for that whole time, but just so they have that expectation about how long, they should be eating or that's expected to be sitting at the table.
Okay, awesome. Thank you. So other than impacts on growth, are there any other concerns that need to be addressed with diet? This question specifically for Heather as our dietitian on the panel. What are your thoughts on nutrition, and how can they impact things like school and sleep performance?
Sure. Yeah, so there have been lots of studies, and we can see lots of evidence from different research on the ways that nutrition does impact those two important areas of life. So specifically, we've seen some things on maybe food, if you're eating a diet that's higher in refined carbohydrates, things that increase that blood sugar to spike, that can have a negative correlation with your sleep, that your sleep quality is going to maybe decrease when your diet's full of those types of foods. So that's a concern, making sure, focusing on getting balanced meals and at least offering that variety of food is really important. And then as far as school performance, that's another area that has been highly researched as well. And the things there that we can see are, you read these studies and you see the results and you're like, it's kind of like common sense, like things that we all should be doing, right, for better health in general. But these kids can be so impacted by it. So it gives a lot of hope, I think, in the big picture, because there's little things we can all do to help these kiddos succeed. So specifically with school performance, research has shown that if you're eating a well-balanced diet, meaning you're feeding them breakfast before school, they're consuming lots of fruits and vegetables and drinking an adequate amount of milk, that those things specifically can really help school performance. And then on the flip side, things that might decrease school performance are diets that would be high in fast food, refined sugars, and like sugar sweetened beverages. Diets that include those will have a decrease in school performance.
Okay, awesome. And so you mentioned refined carbs. Can you just briefly explain some foods that are refined carbs, good sources of carbs that aren't refined for our parents joining?
Sure. Yeah, definitely. So typically we think of like maybe white carbohydrates, like white bread and pastries. Maybe like bagels that are plain bagels, white bread, other like cereals, stuff like that would be those refined. And then anything you'd consider like maybe a dessert, all that stuff is gonna just typically be those refined carbohydrates and sugars. And then on the flip side, those complex carbohydrates are what we want to include in our kiddos' diets for increase in fiber. And those are all going to be like whole wheat products. So any carbohydrate food, bread, pasta food that you can get as a whole grain, or specifically you want to look for 100% whole wheat items, those would be the ones that we want to include more often than not.
Okay, great. Thank you.
Yeah.
So this question is for everybody here. So are there any tools you prefer in your perspective practices to help fill just nutritional gaps in general? I know it's really broad. Catherine, do you want to start?
Sure. Yeah. So I think, I'm thinking about like if kids not being as hungry, or, if they're on these medications, having something like a smoothie or a shake, even something like Healthy Height that might be more appealing to eat, or that can add all of those missing nutrients that they're not getting more easily and more easily consumed. So having something like that available for a snack or as part of a meal. And then, I think just again, like keeping that consistent schedule so that having the parents or the caregivers planning out what the meals are so that they're making sure everything's really well-rounded.
Thank you.
Yeah. I'll add in that maybe some food tips in addition to like shakes, like anything you can do or anything we can do to like increase the nutrition of some of our kids' favorite foods. That's going to be beneficial for these kiddos too, especially if they're picky or like hesitant eaters. So sometimes we'll recommend, like if a kiddo is really stuck on a certain type of like muffin or something, taking a supplement like Healthy Height or even just like pureed fruits and vegetables and adding that into the recipe will be like a simple thing that might help and give the parents some power in a tool that they can use.
Great, thank you. Okay, I have a question next for Dr. Liddell. So we're talking a lot about children with ADHD being treated with medication, but we know that there's a lot of families that opt not to be treated with medication. Are there nutritional concerns for this subset who just children who were diagnosed with ADHD and who aren't taking medication?
Probably not as much. I think it'd be very similar to kind of the general population. There is some evidence, like we said before, that maybe some of those micronutrients might be lacking in patients with ADHD, and it may be just their difficulty around mealtime and having focus around nutrition. So those are vitamin D, iron, zinc, probably are big ones. And hopefully a medical provider that's working on the team would be able to kind of tease out a history of what the patient eats and maybe where some of those deficiencies lie. I don't know, is there other micronutrients that you would think of, Heather, that we would be worried about?
I think it'd be one other nutrient that we see is like magnesium.
Sure.
Too, is a big one. But besides that, it's just if there's any like food group that they're missing completely, then that would be a red flag and something to look into.
Okay, great. So I know we try to avoid in general, the red light, green light food system, like this food's bad, this food's good. But in general, just thoughts around foods that should be encouraged and foods that should be a little bit more discouraged. Heather, are there foods that you'd say we should rule out?
As far as to not
Yeah.
eat?
Or limit,
Yeah.
you know?
Yeah. And again, this, I think it's for everybody's health in general, right? Like this isn't specific necessarily to ADHD, but you know, the less amount of high sugar foods that we consume, the better. Less sugar sweetened beverages, the better our health is going to be overall. And then the more we can focus on a balanced diet. So getting protein, whether that's from meat or plant sources, getting dairy where we can, if that's something that your kiddo will take or drink or eat, whole fruits and vegetables. The more whole and fresh we can get, the better health for everyone.
Okay, great. What are your thoughts? I know there's a lot of upcoming research right now. So what are your thoughts on protein and omega-3s specifically to reduce ADHD symptoms?
Yeah, it's interesting. So the data is kind of all over the place, and it's been I think an area of interest in the last few years, but it's been looked into for probably 20 years now. What are some additional strategies to help with ADHD other than our standard medications? And omega-3s and 6s are a big one. There's been a couple studies that have shown that there is a subset of patients with ADHD who maybe run a little deficient in omega-3s and 6s. And in those patients, when they are supplemented with those things, their ADHD symptoms improve. But again, that's a small subset of patients with ADHD who kind of run low at baseline. So it doesn't mean that omega-3s and 6s are a good, single strategy to treat ADHD, but it may be worth looking into if your kid has a diet that lacks in those omega-3s and 6s.
Okay, great. Great, thank you. So that concludes our panel questions. So we're going to jump to the audience Q&As now. We have our first question. I'm just going to read it verbatim. As a parent of a child with ADHD, I want him to want to eat. He's a great eater when he is hungry, and he isn't just hungry most of the day. My pediatrician said that it is common for ADHD kids to not be hungry until right before bed when parents don't want to feed them. We have to be willing to let him eat a big meal or snack when he's actually hungry. Is this common, and is this the right tactic?
Yeah, I could maybe speak to the effects of the medication. So I think the big thing here is just encouraging parents that there are a lot of medication options, and lots of times maybe their medical provider kind of pushes them towards a specific medicine, but be willing to ask the questions to the provider of what are the other options with medicines. So while the stimulants are kind of our first line treatment, there are non-stimulant medicines that can also sometimes be effective, and they might not run the risk of that appetite suppression as much. The other thing with the stimulants is there's short-acting versus long-acting medicines, and there's all different kinds of preparations. And then there's a huge dosing spectrum too, right? So you got to kind of find that sweet spot where the kid's getting the benefits for performance in the classroom and extracurricular stuff, but not suppressing the appetite too much. So hopefully we can just encourage families to seek out a different option if it's not working well. But yeah, pushing calories to breakfast and dinner time is common because usually the medicines last somewhere between 8 and 12 hours if we're using a long acting one. So if the kid takes it in the morning, lunch is hard, but hopefully before dinner time, the medicine's starting to wear off and dinner can be more successful.
Okay, great. Thank you. So Heather, on the same note, this parent is asking too about feeding a big meal right before bed. Does the benefit of getting the calories outweigh the effects of that? What are the effects of that? Is it okay to eat a big meal right before bed?
Yeah, I would say we want these kiddos to eat and to be able to eat. So if that's the schedule that is working at this time, I would say to continue with it. And as much as you can, like Catherine said as well, having them on a feeding schedule, even if they're not eating, at least being around it, sitting at the table with the family, that will just encourage health in the long run as well. And so as much as you can, maybe you shift as a family to where you have that later dinner meal time, or maybe you have a dinner and then you, as a family, you all have like a bigger snack right before bed, and that's okay.
Okay, great. Thank you. This question's for Dr. Liddell. Do we see an actually, could be for everybody too. Do we see an improvement in appetite the longer kids are on ADHD medication?
Not necessarily. So there are some side effects of the stimulants that are like initially when a kid's starting the medicine, that's usually like headaches or upset stomach, and that's just them getting used to a new medicine. But appetite suppression usually doesn't necessarily go away. It is somewhat dose dependent, so the higher the dose of medicine, the more likely the kid is to have some appetite suppression. But if you're on a consistent dose, the appetite suppression probably isn't going to change over time. Maybe the one caveat to that is if a kid's on the same steady dose, but he's growing and getting older and becoming larger, maybe he's outgrowing his dose a little bit, and so his appetite starts to come back.
Okay, great, thank you. This question is for Catherine. Which tools do you use to measure progress with your patient's treatments? How can you tell that what these parents are doing at home is really working?
So usually, it's just keeping depending on what we're working on or what the child's challenges are, but keeping a log of the foods that they are eating. And we're hoping that variety is growing or the volume is growing. And then I think looking at just their behavior and their attitude around meals. So, if our goal is for them just to be participating in meals and coming to the table and sitting for longer or attending longer and kind of participating with the family, that if they are working on it at home, and then we do see that when they come to the clinic and when I sit down with them for a meal, they're carrying over those behaviors.
Okay, great, thank you. We have a question from Whitney. This is also for Catherine. Is it common for kids diagnosed with ADHD to not be able to swallow certain foods? She said she has a son that will not swallow certain foods, and she never thought it was because of his ADHD.
Not that I'm aware of, unless it's like a texture sensitivity, then but not as far as swallowing that I am aware of. But if it's the texture, being comfortable putting it into the mouth, that it can be related for more of those sensory issues. But
she just followed up and said that she thinks it's the texture for sure.
Okay,
great.
Yeah.
Okay, this question would be for Dr. Liddell and Heather. What are your thoughts on Periactin for an appetite stimulant?
Yeah, so personally, I prescribe Periactin a fair amount. I think it's probably the best appetite stimulant medication that's available for children. I like to keep it in my back pocket as long as possible. So I really try and do a lot of these other strategies we've been talking about. One other thing we didn't really talk about so far in the webinar is something called the division of responsibility. And that's something that a really well-known dietitian, Ellen Satter, kind of came up with a long time ago. But the point is that the parents are kind of in charge of what is available to eat and when we offer it. And the kids' role is to come to the table and decide how much of what's offered they're going to eat. And so I really hammer in feeding schedules, division of responsibility. I go to nutritional supplements like shakes and things like Healthy Height often before I go to Periactin.
Okay, great. Thank you. Mary asked a question. She's asking, how do we approach our pediatrician to have them check for vitamin deficiencies?
Yeah, so I think you can just kind of make an appointment with them and say, here's maybe what I'm concerned about lacking in my kid's diet, and then allow the pediatrician to kind of help tease that out a little bit. For kids that aren't big milk drinkers or dairy eaters, I worry about vitamin D and calcium intake being a little bit low. And those are probably the two most common ones for me in practice, but and then oftentimes I'll utilize a dietitian to kind of help tease out some of the other micronutrients. So yeah, I think it's definitely worth asking if you're concerned. And lots of times there's other symptoms that the pediatrician can hopefully get from the family that might help point them one direction or
Okay,
another.
great. Great, thank you. Okay, it looks like we finished the Q&A portion, which is awesome. 1 second, I'm getting a cue to scroll back up. Okay, sorry, one more question. Which specific interventions have a zero effect on appetite, so does not suppress appetite for ADHD treatment?
So there are some non-stimulant medicines that are available that are not as likely to cause appetite suppression. A couple of those common ones are one's called Strattera. There's a couple other ones called Intuitive or Guanfacine. I use those a fair amount in practice, and they're much less likely to cause any appetite suppression.
Okay, great, thank you. So for Catherine and Heather, Jody's asking, how do I help my selective sensory eater? They're waiting for an appointment with a nutritionist, but he only has a dozen safe foods that he'll eat.
Yeah, so I one of my favorite strategies to use is called food chaining. So you take a look, right, make that list of those foods that he does eat and look for patterns in terms of the texture and the flavor, the color, the shape, and then start by offering new foods that have some of those same sensory characteristics. So, if the child's chicken nuggets is the only one that they will eat, so maybe start with just offering a different brand of chicken nuggets or a different, a little bit different shape or from a different restaurant, and gradually expand the diet by like step-by-step baby steps, offering new foods that way.
Great. Heather, do you have anything to add to that?
Sure. I'll say there's so many things you can do here and tips you can jump into. So one I will say is try and keep mealtime as stress-free as possible. So watching what you're saying about what they're eating. So trying not to comment on if they're eating anything or not, trying not to implement any sort of like 2-bite rules or anything like that. That can really add stress to kids who are hesitant to eat foods. And then do what you can to try and make it fun. Not that you need to go, make every meal look like an ocean scene on their plate or whatever, but little things from, getting little food picks and putting those in certain foods, or like allowing them to have dips like honey if they're old enough, or ketchup or whatever their favorite thing is, like allowing those types of things to just encourage overall eating.
I would say too, like lead by example, right? So we've been talking about like schedules and meal times and the family at the table, but there's a lot to be said with a kid watching everybody else in the family eat something, and that exposure over and over and over, and watching everybody else stress-free continue to try new foods will eventually help the kid to expand a little bit.
Great.
Yeah, and I think to add on that a little bit, just the exposure through things like cooking or shopping with the parent, and even if there's no expectation for the child to eat it, but helping to pick the food up and put it into the cart or to mix it in the bowl, serve it to the rest of the family during mealtime can be helpful. It doesn't happen overnight, but those little things do add up over time.
Okay, great. Thank you guys so much. This was super, super informative. I know I learned a lot. I really appreciate it. And thank you everyone that's watching for asking your questions. We'll be sending you an email with the recording of this. You can go to our website, healthyheights.com. There's an email in there. If you have any other follow-up questions, feel free to email us, and we'll do our best to get back to you. And I will also send Catherine and Dr. and Heather Liddell's blogs to you guys, so you can follow up with them and see what they've been up to and their advice. They're clearly very knowledgeable, so I'll be checking it out. And if you guys could also just stay on after and take a very brief survey, that'll help us out for our next webinar, and we can improve these events. Besides that, I hope everyone has a great rest of their week and weekend, and we look forward to seeing everybody next quarter. Thank you guys again for being panelists.
Yeah, thanks for having us.
Thank you.
Bye.
Bye.
Bye-bye.